And so, we also heard Mark Laslett talk about, okay, so if we do have these systems that are effective in a large group of patients, meaning, looking at posture, movement, behavior of a concordant sign to repeated movements or positions, and you do see a change, is that all that we should be looking at? And he said, no, if you ignore the psychosocial, you'll do it at your own peril. What were your thoughts about that?
I think, yeah, that I think it's known for, like he said, like the 80s. So I don't, it's nothing new really, but people, some do it better, some do it worse, and maybe some therapists also have secondary gain, like the example of a chiropractor that has been seeing the same patient for 8 years and adjusted every month or so. I think they kind of want to have the patient, and they don't want to talk about other stuff, just the yeah, the crack, and that's what you're gonna need. um, so so I think the stuff is known, and if you are, well, a good therapist, you're handling those other factors as best as you can, or you actually see, like, okay, this is more than I can handle, or this is not what I'm good in. Let me refer to another one, exactly like Laslett is talking about. He was the mechanic, and this woman Tracy, or I don't remember, she was like with the software engineer, or what he said.
Yes.
And that was very smart, because you can, of course you could be good in both parts, but then you are really, really well-rounded, and well-read, and well-trained. And I think it's an utopia to think that everybody is going to be that good. So to do a divide, and first be good in first part, let's take care of the most people, then we have the bigger resources, or the more specialized resources for this smaller group that does need some other things, like exactly like Mark Laslett talked about in his last minutes of his
Right.
talk.
Yeah, yeah, and that even reminds me of Joe Donnelly just a few episodes ago when we were on the topic of dry needling, and he mentioned, look, why aren't we referring to each other, knowing that, hey, my skill set is in this group of patients, and yes, I can see patients and outside, but I've got someone over here who's really well read and trained in that particular group of
Mm.
patients. So I appreciated what Mark Lazzett was saying as well. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.